Hi all, it's me Geeta Sanu from Bliss Academy, Thiruvalla. Today I am with you with a topic in newborn care, that is phototherapy in newborn. What's phototherapy? It's a treatment modality used in the newborn care to reduce jaundice in the newborn. So what is jaundice? It's a discoloration, yellowish discoloration of the skin, mucous membrane and sclera due to deposit of bilirubin in the skin, mucous membrane and sclera. So when there is increased level of bilirubin in the blood, it can get deposited in the skin, sclera and mucous membrane, and you can see it as yellowish discoloration. This is known as jaundice, and normally it is caused by increased bilirubin, as I told you. Then what is bilirubin? Bilirubin is a product that is liberated when there is breakdown of RBC. So normally in the body, this bilirubin will be conjugated by the liver and it is made into water soluble form by the liver and it will be excreted through the feces and urine. But in a newborn, the liver functions are not fully established. So this conjugation of bilirubin and excretion through the feces and urine will be affected. So this will cause increased levels of bilirubin in the blood. This condition is very dangerous because as the bilirubin is increasing in the blood, it can cross the blood-brain barrier and it can get deposited in the brain, and this condition can damage the brain tissue, causing problems with the intellectual abilities of the child and resulting in mental retardation. This condition we are calling it as kernicterus. So to avoid this type of complications, we are using this phototherapy as a treatment modality. Now we will see what we are doing in phototherapy is we are exposing the newborn to blue lights, and these blue lights will reduce the amount of bilirubin. And now we will see what are the nursing interventions we have to do when we are doing the phototherapy. Even though it is a very good method to reduce the bilirubin and to prevent complication, it has negative impact also. And this one of the most important negative impact on this phototherapy is this light can damage the eye of the newborn. So as a result, this eye can get damaged. What intervention we have to do? We have to cover the newborn's eye with an eye shield. So this is the first priority intervention or most important intervention related to phototherapy, and related to this area you can expect questions in your nursing exams. Then another problem is this phototherapy can remove fluid from the body, resulting in dehydration. So we can expect dehydration in a child who is undergoing phototherapy. So what intervention we have to do? We have to hydrate the baby frequently. So feeding, and we know that the most important feeding type of feeding is breastfeeding. So breastfeeding should be given frequently, and if not available, other methods to hydrate the baby should be used to hydrate the baby. Then baby's vital signs needs to be monitored frequently, and we have to change the position of the baby also frequently, and we have to expose the maximum skin as possible. But there is one other thing also we have to remember: we have to protect the gonads of the baby also. So we have to cover the genital area and eye and expose all other parts of the skin. Then so as I told you, we have to change the position of the baby also frequently. Another complication which can occur is the baby can get sensory deprivation. As we know that we have closed the eye of the baby and baby is not getting any stimulation, sensory stimulation. So to prevent the sensory deprivation, when the baby is taken out for feeding, we can remove the eye shield for a while. So these are the most important points we have to remember related to this phototherapy. And in addition to that one, even though it is a rare condition, there can be a serious complication that is known as bronze baby syndrome. So we have to observe the child's skin frequently by switch offing the light. That is also very important to remember, that you have to switch off the light when you are monitoring or when we are observing the skin of the baby, and if there is brownish discoloration coming to the skin, you have to report it immediately to the doctor, because it may be an indication of bronze baby syndrome. So these are the most important points you have to remember related to phototherapy. With another topic, we will meet again. Till then, bye.